All right, thank you for staying with us. It's time now to take a look at stories making headlines on the front page of Nigerian newspapers. And I begin with the Daily Times. The major story here says, unfavorable PEPC judgment as the presidential election petition court judgment. PDP, Labour Party smell a rat in Supreme Court fire. PDP, Labour Party smell a rat in Supreme Court fire. Recalls that a part of the Supreme Court caught fire yesterday, and the relevant agencies swung into action to quell the fire, as it is being reported. All right, you find all the details on the front page of the Daily Times. We move now to the front page of the Blueprint. Appeal Court at annual legal year. We got 813 petitions from party primaries, 1,209 for 98 tribunals. And some writers here say, appropriate living budget for judiciary. Chief Justice of Nigeria tells National Assembly. Fagbemi cautions on threat to judges. Fire guts Supreme Court. All right, all the details on the front page of the Blueprint. To the Leadership newspaper. As National Assembly resumes, Akpabio Abbas move to pacify aggrieved lawmakers and to swap committees. Members intensify lobby. Budget, Electoral Act, Economy, Constitution Review top agenda. Senate screens new CBN governor deputies today. And also on the front page, you still see stories talking about anxiety as Labour meets on indefinite strike today. And also talking about tribunal affirming Governor Babajide Sanwo-Olu as Lagos State Governor. All right, to the First News newspaper. My predecessor, Ishaku, emptied treasury before handing over to Raba Governor speaking. Says, I met nothing in state's treasury to start governance. Right. If you want to know more, you look through the front page of the First News newspaper, and still talking about some stories here. Supreme Court fire didn't affect election petition documents, spokesman. Right? I guess some would say, thank God that a part of the Supreme Court wasn't affected. All right, to the Guardian newspaper now. Cardoso faces Senate under forex pressure, loss of confidence. Cardoso faces Senate under FX pressure, loss of confidence. And Cardoso has to deal with spiking inflation, volatile exchange rate, ambiguous external reserves, falling bank adequacy ratio, high interest rate, $6.8 billion backlog, contentious 22.7 trillion naira ways and means advances. All right, those are the issues Cardoso is reportedly going to be dealing with. To the Punch newspaper now. Tinubu reviews document. A CBN investigator submits interim report. Nigerians will know what really went wrong and what brought us down. SGF is speaking. CBN special investigator continues audit. Federal government links nation's woes to bad governance. All right, to the front page of the Nation newspaper now. Probe report will expose rot in CBN, says federal government. Cardoso deputies face Senate screening today. And on the front page of the Daily Independent, NLC takes final decision. Fuel subsidy crisis. NLC takes final decision on indefinite strike today. Again, La Long, that's the Minister for Labour, begs Labour not to paralyze economy, says federal government has already resolved one of their demands. Theophilus?
Well, federal government has resolved one of their demands. Okay, so let's go to the Nigerian News Direct. NCD, MB, NNPC, IOS signs MOU to ramp up oil production. And it says here, the writer says, target 6 months contract cycle as active oil rigs hit 31 in 2023 from 10 in 2022. Regulatory uncertainty drags upstream expenditure by 77.8% in 8 years. A move to this Nigerian newspaper, it says, Diphtheria claims 453 lives in 18 states, according to the federal government. Kano tops list with 6,185 cases. Yobe 640, Katsina 213, Borno 95, Kaduna State 16, Jigawa 14, and 12 other states, including the FCT. We move to Daily Trust. Experts decry government inaction as diphtheria spreads to 18 states. Kano leads as disease kills 453, infects 7,202. Improved measures key to ending scourge. The Salient Times says here, Nigeria has Africa's largest cholera surge. The country reported 23,839 cases, including 597 deaths. 80% of the deaths occurred in local communities. That's in the Salient Times newspaper. And of course, the sad news there says veteran actor Yemi Adeyemi, popularly known as Shuara, is dead.
Yeah, may he so rest in peace.
May he so rest in peace, you know.
Right, I believe that's the last paper you have with you there.
Yeah.
All right, let's quickly touch on this matter of diphtheria that's been spreading. This story is on almost all the papers this morning. Some took it as a headline, others didn't, but it featured prominently in some of the papers how it is that we have a huge burden of this diphtheria. On the paper, Nigeria records 7,202 diphtheria cases, 453 deaths in 18 states. And the Federal Capital Territory. That's a lot. And the concern is government's reaction. Because we recall that when there was COVID, we saw how government swung into action. You can look at it on the front page of this Nigerian newspaper. It's featuring prominently as a major headline there.
Daily Trust.
And also on the front page of the Daily Trust. Government swung into action when we had the outbreak of COVID-19 and also Ebola cases. We saw how government swung into action and also dealing with some other virulent diseases. But for this one, not much has been seen in terms of government's action and perhaps even educating people. Because the diphtheria is airborne as it is. And so we've seen a lot of persons having cold, catarrh, and some are saying, oh, perhaps it's the return of COVID. But again, with this burden that we have, it might also be diphtheria because the person has a cold, catarrh for a prolonged period. The person may not be able to breathe appropriately or breathe well, but it is said to be preventable with the use of vaccine. Now, how available
those vaccines?
Are these vaccines?
But it also puts a burden on our healthcare system.
Right.
Because, for instance, Kano tops the list with 6,185 cases. Now, especially we are in the rainy seasons. And so, like the symptoms you have just reeled out, many people will actually think it's malaria.
Right.
Or typhoid and go to the hospitals. And so if we have our healthcare system burdened by these sorts of situations, then it means that our healthcare is at risk.
Are they able to identify now that we're seeing similarity in symptoms?
Yes. They might not be able to identify because many people don't actually even go to the hospitals. Some just go to the roadside pharmacy and just pick a malaria drug and take, and they feel they are okay. But it's a situation that will explode if we don't have measures put in place, like you have said, to curb these matters. Because Nigerians' healthcare is quite expensive in Nigeria. And so,
out-of-pocket treatment.
Yes, out-of-pocket treatment. And so many people will actually not go to the hospital when they feel ill, when they feel some symptoms, maybe body pains or cold or catarrh or bitterness in the mouth. They might not just go to the hospital. They will just decide to go to a pharmacy. And so when they do that, they might not get immediate relief, but they will keep spreading it. Since it's airborne, they will keep spreading it. And we're in a season when the rainy seasons at this point. So it will tend to spread faster than usual. So it means that serious measures need to be put in place. Maybe because, COVID was worldwide. So everybody all around the world
we're ready to put in the effort to address it.
Yes, but maybe because of that. Because we saw with the case of Ebola, it was according to African disease. And so...
But you also addressed that.
Yeah, they addressed that because it was an African-wide thing. Africa came together to address this particular disease. And so, since this is in Nigeria, maybe we have not seen we still believe that it is the weather.
No, as it is. I mean, 453 deaths recorded already.
Already.
And this matter began, I think, sometime December last year.
Yes.
We started recording cases of diphtheria. But as it is often said, we shouldn't leave these matters to the federal government alone.
No.
States now need to begin to take responsibility, especially states that we have seen recording the highest number of cases.
Like Kano State,
for instance.
Yobe State. And Kano has a lot of population.
Yes. So, in fact, not just them, all the states across the 36 states and the Federal Capital Territory have to begin to take responsibility. And then we need to educate
education is key.
On preventive measures. As it is right now, perhaps you might need to buy a mask because this is airborne. So if you do not want to, when someone coughs, what do you do? If the person does not know how to cough properly into their elbow, as it is. Some people just, sneeze or cough, and then the virus just spreads as it is. And then you do not know, you're not wearing a mask as it is, you're not having preventive measures to take care of yourself, you just take it up and then begin to see yourself react or show some of the symptoms at the end of the day. So it is better to take preventive measures, take care of yourself as it is. If you see the symptoms of cold, catarrh, or you feel you are not breathing properly, go to the hospital. Let them check you. Tell them, okay, perhaps this might be diphtheria if you are not getting the right treatment, diphtheria.
If we even know what's the symptoms of diphtheria, a lot of people might not know.
That's why I said if you are not breathing properly, if you have cold, catarrh, and you are not breathing properly, then you know that this
Don't just take it as though.
I'm not a doctor, so let me not just.
We should just take it as though it's a normal thing. No,
go to the hospital and get checked to know what exactly, so that you can get appropriate treatment to deal with it, and so that you'll not be an agent for spreading diphtheria. It's important to state that. Unfortunately, you don't get paid for being an agent. But then it could cost the life of someone. We have already recorded about 453 deaths. It's important that we take it seriously as it is, and we hope that in the coming days we'll be able to address this burden that is already rising as it is. We have to leave the conversation here